Good morning and welcome to the sixth climate webinar. And this morning we have a very exciting topic, impact of climate change on public health services in Pakistan. And my name is Kenneth Holland, and I'm the Chief of Party for the USAID Higher Education System Strengthening Activity, or HESSA as we like to call it. And I'd like to just say a few words about HESSA. So the purpose of the USAID project is to strengthen the higher education system in Pakistan. And we work with 16 public universities, and one of them is the Lahore College for Women University. So we're pleased to welcome the moderator from that distinguished institution. So the way in which HESSA attempts to strengthen universities is in three different ways. The first one is by improving the leadership of the universities. And so we provide training, capacity building for vice chancellors, for deans, for department heads. And we have a special initiative to help develop women leaders. So we're very proud of that aspect of our project. The second component is teaching and learning. And we develop the capacity of faculty members to make the shift from the lecture method of instruction to more student-centered, active, project-based, outcome-based learning. And we also work with faculty members to help improve their research. And so this seminar on climate change and this whole series of webinars is designed to help develop the research capacity of our faculty. And then the third component is called student success. And here we help students become more employable. And that has two meanings. One is that they become very attractive to private sector employers because they have not only a high level of skill and knowledge in their major, but they also have soft skills like communication, ability to work as a member of a team, self-confidence. So we really put a lot of emphasis on helping universities equip students with soft skills to make them more employable. And the second meaning of employability is to help students who'd like to start their own businesses and be entrepreneurs. And we help them launch their businesses through our micro enterprise initiative. So we're halfway through our 5-year project, and we've really enjoyed working with our 16 partner universities. So I'd like to turn over the microphone to our very distinguished moderator, Dr. Moneeza Abbas. She's assistant professor at one of our partner institutions, the Lahore College for Women University. Dr. Abbas, please.
Thank you, sir. Assalamu alaikum, everyone. In America, I send my greeting, and in Pakistan, a very good morning to everyone. I extend my gratitude to USAID and the HESSA project for providing Pakistani researchers the invaluable opportunity to engage in the research coordination network aimed at addressing climate resilience issue in Pakistan. Today is the 6th webinar of the series with vital theme, impact of climate change on public health services in Pakistan. Before proceeding further, let me introduce myself. I am Dr. Moneeza Abbas, serving as Assistant Professor in Environmental Science Department, Lahore College for Women University, and Senior Advisor for the Society of Environmental Action and Climate-Oriented Network at Lahore College for Women University. With diverse experience as a climate health researcher for the past 17 years, we all are very well aware that there is a dire need to address health issues arising due to climate change in Pakistan. And in this context, I would like to briefly talk about my recent research. And according to the findings, air pollution, particularly smoke, and water pollution especially arsenic and fluoride concentration in drinking water, have serious health impact on the female in and around Lahore, Pakistan. The degrading environmental quality poses serious health hazard, particularly adverse effect on the female reproductive system, leading to miscarriages, abortion, stillbirth, and premature birth, and respiratory problem, as females are more susceptible and likely to be more exposed to locality-specific health risks. In this context, today's webinar will be strengthen our capacity to mitigate the climate crisis. Moving forward, I will introduce our first keynote speaker, Ms. Sumaira Smith. Ms. Smith, currently serving as a Secretary of the Women Development Department, she brings a wealth of experience from her diverse role in the public sector. Previously, she has served as a Secretary, Social Welfare Department, and Literacy and Non-Formal Basic Education Department. Our second keynote speaker is Dr. Adnan Khan. Dr. Adnan is a distinguished medical doctor and epidemiologist with a special interest in understanding issue and health of urban population. He will enlighten us with his insight on cities and resilience to climate change, drawing from his extensive experience, particularly focusing on informal poor urban settlement. His leadership at Research and Development Solutions RADS, a research group dedicated to understanding urban health issue, highlighting the significance of his contribution to our discussion. Following this enlightening presentation, we will engage in a brief question-answer session, providing an opportunity for further exploration of the topic at hand, and finally, concluded our webinar with some closing remarks. Now, I request Ms. Sumaira Samad kindly share the screen and start presentation.
So thank you so much, Lahore College University and Dr. Moneeza, USAID, there's a project for giving me this opportunity to present before you the work that is being done at the Women Development Department in the area of climate change and gender. I will just start with a quick introduction. People I'm sure quite aware of the context of climate change within Pakistan and Punjab. Pakistan is among the 15 countries which are most vulnerable to the impacts of climate. The cumulative effects of climate change has had direct impact on our economy, and so Pakistan is estimated an estimated $38 billion it is costing to our economy. And at the same time, in terms of development, the indicators do not look very good, though there has been improvement. However, in 2022, the Human Development Index of Pakistan was 164th out of 195 countries, and it just improved its ranking a little bit since the last year, the year before that. And in Global Gender Gap Index ranking, we are 142nd out of 146 countries, which is like 3 notches above what our ranking was the previous year. So we are also aware that, and then some alarming figures about climate change itself in Pakistan, that in a 30-year period, 57% of the geographical area of the province in Punjab has experienced an average rise of 0.97 degree to 1.14 degrees C in minimum and maximum temperatures. And in 2022, we experienced an alarmingly high area average mean temperature of 0.88 degrees C. And the province has experienced an increasing trend of precipitation, which has also, we saw that in 2021, we had this horrible flooding in South Punjab and in Balochistan and in Sindh. So within that context, we are aware that in this kind of context, which is with this severe impact of climate change, I'm going to talk particularly about Punjab. That we are aware that vulnerable groups and like women, they experience it. The impact has a greater implication for vulnerable groups and for women, and so that is what we are looking at today, and this is what presentation is about. The framework for the work that we are doing in the area of gender and climate change is is the National Climate Change Policy of 2012, which was updated recently. And then we have the Pakistan's Climate Change Gender Action Plan of 2022. Then we have Punjab Women Development Policy of 2018, in which climate change is a major theme. Then we have a framework for the implementation of that policy, in which we have assigned various actions to different departments, and then there are climate change related, environment related actions for various departments, with timelines, and having a bearing on women. And then we have policy packages for 4 years, which also have, there are various initiatives in the end. Sort of we are linking the work that we're doing in the area of health for women and climate change and how they are related to each other within the context of our work. And then we have a draft climate change policy of Punjab. It's just been sort of, finalized, the draft, and it's going to be sent to the cabinet. So that is one thing that has recently happened, and our department, the Women Development Department, was intensively involved in the and then we have Punjab Gender Parity Report, which the Women Development Department publishes annually, and it brings together gender disaggregated data across 7 thematic areas: education, health, demography, justice, and governance, and economic participation and opportunities. So that is the framework. Just a little bit about the climate change gender action plan. Obviously, we understand that the work of climate change is cross-cutting, and so it involves various sectors and departments working together in order to fulfill the activities on the objects. So that's what we see in this gender action plan as well, because they talk about participation, representation of women at all levels of climate policy, planning, and decision making, strengthening coordination, and promoting institutionalization to address gender issues and support gender mainstreaming. Then it's develop gender responsive climate actions through national and provincial policies, collect gender disaggregated data, invest in context-specific research, develop a framework to monitor progress. So this is the general kind of context of the gender action plan. Within that, almost all departments of the government are involved, and obviously the health department and its allied agencies in the public sector, private sector, as well as the civil society. So they work together under this framework. The key principles of gender inclusiveness given in the document and in other documents are, as just sort of mentioned, participation and representation, coordination and institutionalization, policy and programs, gender disaggregated data, context-specific research, and monitoring and evaluation. So the Punjab Women Development Policy, this is the first women development policy of Punjab, which was published by the Women Development Department in 2018. So as I mentioned, that climate change and the impact it has on women and what the response needs to be is integral to that document. And I will later share the links to this document as well. Obviously, the government of Punjab is committed to undertake mitigation and adaptation measures for ameliorating and minimizing the impacts of climate change. And the world's poorest and those in vulnerable situations, especially women, as we have just spoken about, bear the greater brunt, and that has to be contextualized. It has to be sort of nuanced, disaggregated, and the impact on different sections of society, different groups, needs to be researched and studied and differentiated in order to plan appropriate policy interventions and projects. As we've seen that, in many situations, we see that because of the social and cultural context, we will see that women will be the last to eat or to be rescued, and they face greater health and safety risks, as water and sanitation systems become compromised. During droughts and floods, the impact on women are different, from those on men. And at the same time, women's contribution to climate action has to be documented, because women are very much involved in the work of adaptation, the work of livelihood, and the work of managing homes and communities. And so they kind of, by virtue of their role in society, they are involved in adaptation, adaptive activities, and they have a very vital role to play, and that needs to be acknowledged and strengthened and learned from. And at the same time, women require that kind of training and resources in resilience and in response. One of the goals of the policy, excuse me, in the policy document is support women, men, and families, especially those living in fragile ecosystems, against the adverse impacts of climate change. This will be achieved through enhancing gender responsiveness of natural resource management, planning and climate resilience mitigation, and disaster risk reduction strategies. So the policy objective is what we've just mentioned, and the various strategies for this is our gender audit of provincial climate change and natural resource management policies and interventions to identify policy implementation gaps, and the gender audit of provincial climate change and natural resource management policy to identify policy implementation gaps for enhancing participation and enhanced benefit for women, and and institutionalized knowledge and development and research for collecting gender disaggregated data and gender profiling to inform planning and development processes. So we've assigned these different objectives to different departments. For example, gender audit of provincial climate change and natural resource management policies, and to identify policy implementation gaps has been assigned to Environment Department and to Forestry and Wildlife Department. The institutionalization of knowledge and development research for collecting gender disaggregated data and gender profiling for planning and development has been assigned again to Environment Department, Forestry and Wildlife Department, and the Planning and Development Department. Then capacity building of government organizations, civil society, media, for ensuring gender mainstreaming across all provincial climate change policies programs. That's again Planning and Development and Environment Department. Ensure national climate change policies and reporting systems incorporate gender concerns with reference to international treaties. That's again Environment Department and Planning and Development Department. Enhance equitable resilience of women and men living in vulnerable ecosystems against climate change-induced disasters through gender-responsive disaster risk reduction and resilience. That is the Provincial Disaster Management Authority, the Planning and Development Department, and the Women Development Department. So these are various actions that have been given in the policy and in the action framework, and different departments have been assigned this task with timelines, and the task of the Women Development Department is to monitor the progress on these actions. Similarly, the policy has an action framework for the health of women. So the main policy areas are ensuring access to primary, secondary, and tertiary healthcare facilities for all, healthcare systems to be effective, efficient, fully catering to needs of all sections of society, ensure equal access to adequate and quality healthcare as a matter of right for every citizen, covering preventive, promotive, and curative healthcare regime, and mainstream and complement the role of public and private healthcare sectors for providing low-cost, high-quality, and affordable healthcare services for all. So what I mentioned before in terms of climate change, what the policy says about climate change, what the policy says about health, they are related to each other. When we are looking at the climate change response, and we're looking for disaggregated data, we're looking for ensuring that there are no gender gaps in policies and programs and interventions, and the men and women living in vulnerable ecosystems, they get prevention against disasters and against the impact of climate change. So health is central to all of this, and as we see that health itself is a cross-cutting area, because so many factors play into how robust the health system is. For example, education, for example, access to family planning services, and sort of, the kind of infrastructure that is developed. So many departments are actually for the food systems, the security and safety systems. So many departments are directly involved in the provision of robust health services in the context of climate change to women. Then we have the other policy objective. The policy objective within this policy for health is to transform and reconfigure healthcare system in Punjab as gender sensitive, covering all aspects of promotive, preventive, and curative health services for reducing burden of disease for both men and women. And this is to be achieved through the following policy strategies. Measurable gender-sensitive assessment of healthcare system within the context of SDGs through inclusive interventions for lowering burden of disease for women alongside men, sharpening and documenting focus of minimum service delivery standards regime in primary, secondary, tertiary healthcare for women alongside men, including cancer screening and mental health care, operationalized system to monitor gender gender inequalities in access to health service delivery in lesser developed regions for vulnerable sections of society, gender audits of provincial health sector reforms programs for identifying and addressing gender gaps. So like we can see that, these actions have been primarily assigned to the health department and the planning and development department. And then advocacy and state care consensus building for ensuring requisite budgetary allocations to remove gender disparities in access to universal health care, roadmap for addressing gender-based gaps in health service delivery, including women's reproductive rights, maternal and child health services, gender parity and food security and malnutrition challenges for women through targeted interventions, and equitable provision of WASH and population welfare services. So again, we have finance department, the population welfare department, the P&D and local government department, various departments involved in all these actions. Then, sort of, as I mentioned, that for this policy, there's an implementation framework, and that so we've just talked about that. And so the implementation, this is the detail of the implementation framework. What I was talking about, then that breaks it into smaller actions basically, and gives timelines for each action. So this is the implementation framework for the areas of interventions that I just talked about, which the policy gives. So for example, disaster affected women are able to receive government support package and sort of, and reduce vulnerability of women in disasters. Lower negative environmental risks resulting from swift complaint resolution. Disaster affected women are able to receive government inclusive departmental guidelines. And then awareness to change perceptions and catalyzing change in social norms with regard to the role of women in disaster situations, reduce vulnerability of women in disasters, special focus and emphasis on vulnerable populations. So these are the specific the goals that have been given to various departments at timelines. In order to be prepared for any disaster, in order to kind of, make our systems and processes and intervention robust in the context of climate change for the health and well-being of women. So we have then, so that was, the framework given for climate change. And then for health within that context is lower risk of maternal and infant mortality, demand increase for family planning services and ensuring access to safe and quality services. And this is in a context when there is no disaster, but also during disasters, as we shall sort of speak about later. Some observations from the lessons learned from the flood of 2021 in terms of health services to women, and which included family planning. And then the minimum service delivery standards, for ambulances to be developed, lower risk of maternal and infant mortality, daycare centers in healthcare facilities, so separate washrooms, prayer area, and then efficient and safe patient transportation with reduced lead times and increased service delivery in neglected areas. And then we have data and sort of, mapping, the Punjab in terms of the multi-cluster indicator surveys that we have across various indicators to measure inequality and capacity building. So so these are various, and this document is also available on web, and I will send a link to this document. So this is the kind of work that we are doing in terms of climate change, in terms of the health of women, at the level of the Women Development Policy, and in the framework of the National Policy and the Gender Gap Action Plan. Now, recently, the draft of the first Punjab climate change policy has been developed. Climate change, this subject has been devolved now, and earlier the department functioned within the framework of the national climate change policy. And so for this, we had a separate consultative session at our department in order to ensure that gender concerns were embedded, in the entire document. We did not want it to be a separate paragraph, saying that, that is also important to separate section, but we wanted gender concerns to be embedded within all sections of the policy. So, excuse me. So for that we had, and so the objectives of the policy, there's a line of objectives, and those and which includes integration of gender equality and just transition into climate actions for the whole province by recognizing the disproportionate impacts of climate change on women and girls, and making gender responsive planning and development strategies. Engage youth, women, and civil society to enhance awareness and education of climate change, and community level actions to build resilience against climate related risks. And so the policy areas, as you can see, are water resources, ecosystem, disaster preparedness, human health, all of these policy areas. And we've sort of, we've made our best attempt to integrate gender concerns, women concerns within all of these policy areas within the larger policy document. So regarding health, within that policy, regarding health, we have conduct need assessments of the health sector, improve geographical spread of health facilities between urban and rural areas, ensure that appropriate measures to address climate change related health issues are incorporated into provincial health strategies and plans, upgrade, extend, and implement climate and environment health related diseases outbreak of forecasting and monitoring systems. So so these are the various policy measures in the climate change policies. We have given special emphasis to gender-based violence because that is obviously very much related to women's well-being and health. If I had time, I would go on a little bit more into the kind of actions that the government has taken. Just a quick sort of overview of social inclusion of women, the present situation, and this is we've collected through various sources, primarily from our gender parity report, and this kind of feeds into policy, and so these are the various social. We can see that for women, though there has been has been increase in healthcare services, but there's still issues of access and sort of making it more sort of specific to various kinds of needs of women. As we can see that in the health sector, anemia has decreased, but tetanus immunization. So anemia has decreased, and the tetanus immunization has increased. Then we can see that the doctors, in terms of the doctors, female doctors, we have MBBS doctors, but when in the specialized doctors, we have less. We have less women doctors working in the working compared to those who sort of do their medicine. That is an area to be looked into. What are the barriers for these women to work in their field? Then in terms of economic opportunities, we can see that, women, there's a big disparity between men and women. Then again, in access to financial resources, there's a big gap. And we can see when interventions are devised, which take the context to women in consideration, like microfinance and Benazir income support program, then women become more involved in it. So again, sort of land holdings, there's a big disparity. And we can see that in terms of the representation of women, though there's a Fair Representation Act in Punjab, And there's a sort of a quota outlined for 33% quota in all committees and task forces, and of course, obviously quota in Punjab Assembly, and they have, and every party has to have at least 5% women on direct seats. Still, you can see that there's a big disparity, between men and women in terms of political as well as professional representation in areas of decision making. Again, in justice, there are big problems because the crime rate is very high, but the conviction rate is only 5% conviction, 95% acquittals. So, and again, in terms of registration of birth, there has been improvement, but in the registration of death, there's still a big disparity. So all of these issues, and then just a quick one on disabilities. We did some analysis of the men and women coming for disability assessment to the disability assessment boards. And in that, overall, only 27% women are coming to get their disabilities assessed and get certification. Now, this is my last slide, just a little bit on the work that we did during the floods. We visited Rajanpur and Dichi Khan, and what we outlined was that it was very, very important to get gender disaggregated data and nuanced data of women, and then women with disabilities, women with more children, women with CNIC cards. So these are the kind of observations we made and shared with the Planning and Development Department in order to incorporate in the work of the provincial Provincial Disaster Management Authority. We stressed the importance of local government, how important it was to have a local government, a functional local government. We stressed the importance of, providing health services, quick and consistent health services to women, pregnant women. That was a very big issue as well. And then the women to get some privacy, to have demarcated areas for women's privacy, to make sure that the documents that the women lost, for example, their marriage certificates, their property certificates, CNIC, women should be given a priority in remaking those documents and several other things. So overall, this is a very brief presentation of the kind of work that we are doing in terms of women, in terms of the health of women in the context of climate change. Thank you so much.
Thank you, ma'am, for sharing your valuable insight and expertise with us. Kindly stay with us because we might have some question at the end of the webinar. Now, our second speaker is Dr. Adnan Khan. Sir, kindly share your screen and start your presentation.
Thank you very much for HESSA and to have me here for this talk. I'm going to talk a little bit about health and climate change and resilience from it, mainly because from experience that we have of working in urban informal settlements in Rawalpindi. Just a little bit about my group, RADS. We are a research company. We do a lot of survey evaluation, but our main things are we do a lot of knowledge management and evidence generation, multi-data-based triangulation, as well as we operate an urban impact lab in Rawalpindi, which covers about 400,000 population right now, where we can track individual households, so about 100,000 individual households with interventions that we conduct. And we are about 20 to 30 professionals, and we have a RADS research fellowship, which is open to fresh graduates, both undergrad education as well as master's degree. We take 2 to 4 fellows every year. So just moving on, we publish a lot of our evidence internationally in papers, but also locally as information briefs that we work with the government to take up evidence from. Just to move on, what is urban resilience? I mean, we're going to touch on these topics. So urban resilience and climate, particularly in terms of climate change, is challenged by these factors: population growth, weak governance, inadequate infrastructure and services, effects of environmental pollution, vector-borne diseases that are exacerbated by these things, and of course, at the heart of it all is social vulnerability, mainly because of economic inequalities and exclusions. So what exactly is resilience? Technical definition is the ability to anticipate, prepare, and respond to hazardous or unforeseen or previously unforeseen, sometimes foreseen events and trends and disturbances. I mean, basically, things are going to happen that you haven't planned for. It applies equally to economic shocks as it does to climate shocks. And the ability to um, take this to address them is very much dependent on the resources you have. So if you are poor, if you are unable to have um, a financial cushion or a social cushion, we can talk about that in QA perhaps, then a bad event that you hadn't previously foreseen. So your ability to cope with such shocks is limited, and sometimes they will sink you below poverty, and sometimes it could be life-threatening. Migration helps, but it also comes. So migration can take you from a constrained or an area where bad events are happening to a different place where you're in a better situation, but it comes with its own set of problems, and we see that in urban informal settlements. So moving on, one of the biggest things that Pakistan is facing a challenge, both in terms of climate change as well as economic stress, is population growth. Our population since 1970 has grown fivefold, compared to about 2.5-fold of our neighbors in the region. So obviously we are outgrowing our resources and our ability to cope with them. And all of these things that you're seeing on the screen are happening. In part because of that, big things being water constraints. We are a major water constrained area, and our ability to educate children, a third of our children are out of school. That just doesn't bode well for our future. So coming back to what exactly do we know? What we know is a big issue in limits to resilience to climate and other shocks is weak governance. Part of it comes from poor planning. So for example, we work in Rawalpindi in with what started with 3 UCs, now it's gone to at least 8 or 9. But the 3 UCs that we started with, we were told by the government that there were about 70,000 people. In fact, when we actually used crowdsourcing and some satellite imagery techniques using Google Buildings data, there are actually 235,000 people. So on government record, there were only 37% of the population that was actually there on the ground. So undocumented populations that are not on government records do not receive government services. So there are only 3 government schools, but 116 private schools. There are no healthcare clinics, but 108 private health providers. Limited infrastructures limits the ability of people to cope with situations of health and climate change. Part of it is because of lack of representation. If you're not documented, nobody's talking to you, you don't have representatives talking to people, and we'll see some of that in the following slides. And then that lack of responsiveness will lead to further lowering of your economic abilities. even in cities are supposed to actually be drivers of progress. But if you are excluded economically as well as socially and democratically, then that becomes a bit of a problem. So the other thing is inadequate infrastructure, and it could be any of those services: housing, water, sanitation, health, or education. Just look at this picture. This is from Dhoka Su in Rawalpindi. This is actually one of the better places in the area. You see haphazard buildings cutting across the road in time. So the road is kind of windy because of that. The buildings, if you look at the top floors, are projecting in. They're going to start touching. You don't see this here, but there are lanes where 3 or 4 story tall buildings are nearly touching each other across the street. So no sunlight to the ground situation. Look at the wires, look at water. You at the bottom of the thing on the right, you have open drains. All of those things are inadequate infrastructure that impede the lives of people. Employment poverty issues we've talked, there are limited scope of people, there's limited transport so that people can't travel out. A lot of work that happens. Fortunately, Dhoka Su is right next to Rawalpindi Sabzi Mandi, the vegetable market. So quite a bit of employment there, but very unskilled. So low paying employment, which really leads to about an median family income of about 32 to 35,000 rupees a month for a family of 7. Obviously, there are issues of climate change. We get flooded all the time, and there are no early warning systems that tell people that. This comes from a survey on water. Water is scarce. At most, it comes for 1 to 2 hours. You see the circle in the middle. Only about 1/4 of the people receive water for about an hour every day. A lot of them, about 1/5 of them actually receive it once a week, and so on and so forth. It costs about 10 to 15 rupees, and this is a survey from 2019. The cost may have gone up. About 10 to 15 rupees a day to get that water. But look at this. Time cost, the time the family spends, is about 1 to 2 hours a day to get that water. 2 out of 5 households feel that the water they get is inadequate. And when we tested water lines, 81% of the water available is contaminated. Part of it is because of this. Look at that garbage. In the next slide, I'll show you that garbage seeped in sewage water. That water is seeping down. Half of the houses are receiving water from boreholes. All of those boreholes are contaminated. Water lines that come in, 25 to 30% of the houses get water from water lines that are run by the government. When they don't have water flowing in them all the time, they crack. When they crack, negative pressure sucks in the sewage from around them, so they become contaminated. That's why 81% of water available to this settlement is contaminated. Very common to have sewage around them, and fairly expensive to get sewage done. There was a brief period when the government of Punjab actually outsourced the garbage collection, and for a few years that actually worked well. I think that stopped. This is what I was talking about. This is practically happening inside the lanes. Water flowing all over the road as well as between the buildings. That's seeping in. It's where mosquitoes breed, causing malaria and dengue. And then waterborne infections, E. coli is very common. That's your garden variety diarrhea that kids are getting. I think 1 in 6 children on PSLM surveys has had a diarrheal episode requiring a medical visit in the last 2 weeks. That's what your survey data shows. That's happening in these urban slums. And then they cause repeat outbreaks. There's no monitoring, but that needs to happen. Reporting and use of that data at local level, it cannot go to Lahore and come back. It cannot come to Islamabad and come back. It has to be dealt with in Rawalpindi by Rawalpindi health authorities. Environmental pollution, again, some of it is produced by residents, a lot of it is produced remotely. So Islamabad has a sprawl. So we have about 2.5 million population, over 1,900 square kilometers. Compare that with Karachi, which has 10 times as much population, over 3,900. So 5 times low population density, which means people are spread wide. Average car, 400,000 cars that are driving every day for about 50 to 70 kilometers. Each kilometer puts in about 0.2 kilogram of carbon out there. Just do your maths. That's why Islamabad is nearly as bad in air quality as Lahore and Karachi are. And other things, heat, it has been a bit of a problem in the recent times. Look at this building. On the left, the picture below, left side, a building, a structure of houses, a right side, a structure of houses, a solid lane in between. Yes, you see a little bit of an open drain, but the point is, so few, such little greenery. These are all urban heat sinks. Heat is a problem. You have lots of heat sinks. Water pollution, we've talked about this, lack of green spaces. We just don't see that much happening. And you see, if you see, so we did a time-lapse thing on Dokasu since 2012. It used to be about a third of the population, the surface area was green. It's all gone in last 5 to 10 years. Again, I mentioned this, the first picture is from actually Karachi. The emergency below, that's E11 floods that we saw a couple of years ago. That's all part of environment. Poverty, we've talked about. If you don't have enough to sustain you tomorrow, if you can't earn income tomorrow, then any interruption in your ability to earn on that day means you don't get to eat. And that's a very real situation for about 20–30% of the population, and in cities particularly. Food insecurity becomes a starvation problem. 39% of our children are severely malnourished, and that just think of that. They're not learning. Third of them are out of school. A third, 2/5 of them are so malnourished that they can't learn. What kind of a future are we heading into? So that's kind of it. I'm going to these are on the left, there's some key observations. I'm just going to leave them out there, but let's just summarize by saying, what would resilience look like? I think it would look like local governance, so people can have a say to their government representatives and have facilities around them, in the infrastructure that's around them. More economic agencies, that may mean transport, that may mean open markets a little bit, ability to connect to the markets, etc. We need to see women in workplace in urban areas. So Pakistan labor force participation for women is about 24%. In cities, it's about 9%. That has to change. So, there's 1 woman in workplace for 7 men, which essentially means 6 women are sitting outside. Maybe not 6, 5 are sitting outside. That has to be, that builds economic resilience, that builds in a character. Ms. Sumaira also talked extensively about women in workplace. I second that. Better housing, heats, material and ventilation, cooling. In Bombay, they're actually talking about air conditioning as a human right. Are we ready to even start to think of that? They're talking about energy sources so that air conditioning can be given to people 6 or 7 hours a night regularly in urban slums. I'll leave that thought with you for a second. We need commercial and private sector in water and sanitation, and we certainly need green spaces. I think I'll stop there. Thank you.
Thank you, sir. Your expertise has added immense value to the webinar. Now the host is open for answer question. This is a question from Professor Dr. Arfa Tahir from Lahore College for Women University. She wants to ask, could you please provide example of pilot projects that have been successful in empowering women in the context of climate change?
Yes, so there have been many interventions up till now. For example, in the livestock department, there have been projects both in terms of provision of training to women in terms of various handling of the cattle, of poultry, of the management and upkeep and breeding of poultry, and in the health of animals. So there have been various projects and ongoing interventions as well in terms of these activities in the livestock sector. Similarly, in the agricultural sector, there have been farmer field schools, and some have been women-specific, in which training has been given in terms of various crops and vegetables and their planting and their upkeep. And since agriculture department has done some zoning in terms of climate change as well, so they are designing various interventions, in the context of those zones which are going to be and are being impacted differently by climate change. In terms of the Women Development Department, we have, like outlined, we have this policy in which we feature climate change, and we have assigned, as mentioned, different actions to different departments. And similarly, the policy packages that I mentioned from 2012 to 2017, that has a huge list, not a huge, but has a big list of interventions for women, which had been outlined, and we kind of keep monitoring their progress. So many of them are aligned with the kind of are aligned with activities which, for example, representation of women, for example, enabling for women to work, for example, health concerns of women, education, transport. So all of these build up the resilience of women in terms of the impacts of climate change.
Thank you, ma'am. There is another question for you. Can you please tell us about on what scale of the policies are really implemented in the Punjab? And can we introduce such policy in other provinces like KPK or Balochistan? Because women in these areas more suffer.
Yeah, there are various social contexts. So women kind of have suffer in different places, but and in their contexts are different. So in Punjab also, there women have a lot of difficulties in various places in various contexts. We have, obviously, there's always going to be a gap between policy and implementation. Similarly, between legislation and implementation. So yes, I mean, there has been implementation. The fact, the most important, I think, what is very important is that we do have good, complex, nuanced policies. We have good laws. Now, there is implementation to a certain level, to a certain extent. However, in terms of these better implementation, there's always a kind of the efforts are always made from our department. Obviously, ours is a watchdog department, and we monitor the policies and the laws. So there's a constant effort being done. So our Punjab Gender Parity Report publishes data in terms of what special initiatives are also being taken and how much progress has been taken and what are the gaps. So the answer to this is that while yes, there has been implementation, but there still are gaps to be addressed. And in terms of the other provinces, they also have their women departments, they have their climate change departments, they have their policies, they have their laws. And I suppose, and like Punjab, they are making their effort as well for that implementation. The important thing for us is to learn from each other And for that, we our Punjab, the Commission on the Status of Women, as well as the Women Development Department and the Ombudsperson's persons departments in the various provinces, we have been interacting with each other. And I think that kind of interaction needs to be more consistent and sustainable so that we learn from each other.
Thank you very much, everyone, and our speaker once again for taking part from their busy schedule, for sharing their knowledge and expertise with us. Thank you, all of you. Now, I would kindly request Dr. Ken Holland, Chief of Party, HESSA, to kindly conclude the webinar.
Thank you, Dr. Abbas, for moderating this fascinating webinar. And I want to thank our distinguished speakers, Ms. Sumaira Samad and Dr. Adnan Khan. And I wanted to say a little bit about the priorities for the United States Agency for International Development. This webinar actually touches on two of those priorities. One is the United States is trying to help Pakistan become more resilient with regard to the effects of climate change, and especially with the idea of helping women deal with the deleterious impacts of climate change. So this webinar is very important to the efforts of the U.S. mission in Pakistan. Secondly, I'd like to encourage all of our speakers and members of the audience to help us in our efforts to develop a research coordination network. So in this area of climate change, we're especially interested in helping researchers at universities, at think tanks, at government agencies, at non-governmental organizations to collaborate on research. We think that the research will be more effective if teams of researchers are working together. So Dr. Abbas, I would ask you if you could perhaps give me some ideas about faculty members you are aware of who might be encouraged and helped to collaborate in the area of climate change, especially as it impacts women. So I want to thank everyone for participating and for your very insightful questions and comments. And I wish everyone a wonderful Ramadan, and we'll be talking to you again. Thank you.
Thank you.
Thank you.
Thank you, sir.
Take care.